Look at your fingertips right now. Press them together. Look at the skin on your hands, your shins, maybe the back of your neck if you can reach it. What you see right now is not skin. It is a printout, a running log of everything your blood has been doing quietly for years before a single doctor ever ordered a fasting glucose test. I am an endocrinologist and metabolic clinician, and I need you to understand that by the time a conventional diabetes diagnosis arrives, the body has already been broadcasting its distress for a long time. The signals were there. Nobody taught you to read them. Four conditions announce themselves through these external signals before standard blood work catches them. Type 2 diabetes, prediabetes, which affects nearly 1 in 3 adults and goes undiagnosed in the vast majority of cases. Insulin resistance, which can be running silently for a decade before glucose levels technically cross a diagnostic threshold. And metabolic syndrome, a cluster of cardiovascular and hormonal disruptions that dramatically raises your risk of heart attack, stroke, and kidney failure. All four of them speak through the skin, the circulation, the nerves, and the eyes before any blood panel confirms what is already happening inside. Let me tell you about a patient, 43 years old, an office administrator. She came in because her vision kept blurring at the end of the workday. She assumed eye strain. She mentioned it almost apologetically, the way people do when they think they're wasting your time. During the exam, I noticed the skin at the back of her neck, a velvety, slightly darkened thickening that most people assume is a tan line or dry skin. I noticed a small skin tag cluster near her armpit, and I noticed that her lower legs had a very subtle, coppery discoloration she had never mentioned because she assumed it was an old bruise that never fully healed. We ran a full panel. Her HbA1c, that is the hemoglobin A1c test, which measures your average blood sugar over the past 3 months, came back at 9.2. She had been diabetic, actively diabetic, for what we estimated was 4 to 5 years. She had never been told to look for a single one of those signals. We started treatment immediately. She still has her kidneys. She still has her full vision. She does not yet have peripheral neuropathy. That is not a feel-good story. That is a clinical fact. When was the last time you actually looked at the skin on your neck, your armpits, your shins, and your feet with the same attention you give to checking your phone? Here is what the conventional medical system does with prevention. It waits. There is no billing code for telling a patient what their skin is saying before the glucose test confirms it. Your next appointment will not include a systematic external examination for pre-diabetic signals. Not because your doctor doesn't care, but because the system is structured around confirmed diagnoses, not pattern recognition. That is a structural failure, and it is costing people their feet, literally. I am telling you what they will not. If you are not already subscribed to this channel, do it now. I am building toward 100,000 people who can read their own bodies. I need you to be one of them. Now, the most dangerous myth about diabetes, the one that has caused more delayed diagnoses than almost any other. The myth is this: diabetes is something you can feel, that it announces itself with obvious symptoms, constant thirst, frequent urination, dramatic weight loss, and that if you are not experiencing those things, you are fine. That is completely, clinically, demonstrably false. The American Diabetes Association has documented for years that type 2 diabetes and prediabetes are largely asymptomatic in their early and even middle stages. The classic symptoms people are told to watch for, the thirst, the urgency, the blurred vision, these appear after years of metabolic disruption have already occurred. Believing that you would feel it has caused you to misread every quiet signal your body has been sending since before those obvious symptoms had any reason to appear. You would not feel a slow flood in a basement until the walls started buckling. That does not mean the water was not rising. Now look at the back of your neck. Right now, reach back and feel the skin along your hairline and down toward your collar. If the skin there feels velvety to the touch, slightly thicker than the skin on your forearm, and appears darker than the surrounding skin, not a suntan, not a shadow, but a persistent brownish or grayish darkening, that is called acanthosis nigricans. The mechanism is this. When your blood insulin levels are chronically high, insulin starts binding to receptors on skin cells that it was never meant to target. It acts like a fertilizer applied to the wrong field. Skin cells in friction zones and skin folds multiply too fast and thicken. That velvety patch is a speedometer reading. It tells you that insulin has been elevated, not for a day, not for a week, but long enough to remodel tissue. Studies in the journal Diabetes Care have associated acanthosis nigricans with insulin resistance in up to 74% of cases in high-risk populations. If you feel it right now, this is a this week's signal. Book a fasting insulin and glucose test, not a standard annual checkup, a specific test requested by name. At home, right now, take a photo of that area in good lighting and compare it to the skin on your inner forearm. Now look at your skin tags. Small, soft, flesh-colored growths that hang off the skin by a thin stalk, usually in the armpits, the neck, the groin, or under the breasts. Most people think these are cosmetic nuisances. They are not cosmetic. They are flags. The same mechanism that drives acanthosis nigricans, chronically elevated insulin acting on the wrong receptors, also promotes the benign overgrowth of small skin and fat cell clusters. Research published in the European Journal of Dermatology found a statistically significant association between multiple skin tags and insulin resistance. The key word is multiple. One skin tag means relatively little. 3 or more in friction zones changes the clinical picture. This is not an emergency signal, but it is an at your next visit signal, particularly if you also have the neck darkening. At home, count them. If you have more than 3, write that number down and tell your doctor explicitly. Do not assume they will notice on their own. Pay attention. This is the most important signal I will describe. Look at your lower legs and feet. Take your socks off if you have them on. Look at the skin on your shins. Is it shinier than the skin above your knee? Is the hair on your lower legs noticeably thinner, patchier, or absent compared to higher up? Is the skin there dry to the point of cracking, despite you not living in a desert? This is peripheral arterial compromise, the earliest observable evidence that small blood vessels are beginning to lose their ability to deliver oxygen and nutrients to the extremities. Diabetes damages the endothelium, that is, the inner lining of your blood vessels, through a process called glycation, which works like rust forming on the inside of a pipe. The pipe's narrow, blood moves slower, skin loses its feeding supply. Hair follicles in the lower legs are among the first casualties because they require consistent blood flow to sustain growth. By the time you are losing leg hair and noticing shin skin changes, you are not looking at a cosmetic issue. You are looking at a physiological recording of vascular compromise that predates conventional diagnosis. The statistic you need to hear: more than 50% of diabetes-related amputations are preceded by years of unaddressed peripheral arterial disease. Grade this as see your doctor this week. At home right now, run your fingers along both shins. Compare the hair density. Press your thumbnail gently into the skin of your lower shin and release. The color should return within 2 seconds. If it takes longer, that is called prolonged capillary refill time, and it matters. Now look at your feet, turn them over if you can, or use your phone camera. Look for any area where the skin appears yellowish, thickened, or calloused beyond what you would expect from normal shoe friction. Diabetic peripheral neuropathy, nerve damage, causes altered pressure distribution when you walk because you stop feeling where the pressure is concentrated. The body builds callus where stress accumulates. A callus in an unusual location on the ball of the foot, the outer edge of the big toe, or the heel is the body's architectural record of a changed gait pattern driven by numbness. A simple self-test you can run right now. Take a piece of tissue paper or a clean cotton cloth and lightly drag it along the bottom of your foot. Then do the same along your inner forearm. If the sensation feels meaningfully duller on the foot than the arm, that asymmetry is a signal. Report it. Do not wait. Now look at your eyes. Not into a mirror, just blink, deliberately, and notice. Do you experience episodes where your near vision blurs and then clears within a few minutes? Not all day, not permanently, just intermittently, especially after meals? Fluctuating blood sugar causes the lens of the eye to swell and shrink as glucose concentration in the fluid surrounding it changes. The lens is extraordinarily sensitive to this. It swells with rising sugar and shrinks as sugar falls. This produces transient refractive changes, the same effect as a camera lens that keeps going slightly out of focus. This happens before any structural retinal damage has occurred, before diabetic retinopathy, before hemorrhage. The lens is essentially a glucose meter with no batteries and no readout. It just changes shape. If you notice intermittent blur that resolves on its own, particularly after high carbohydrate meals, that is an at your next visit signal that you should name explicitly. I notice my vision blurs after eating and then clears. Those 9 words will change what your doctor looks for. The forgotten zone that almost no one examines, the gums. This is a separate universe. Periodontal disease, chronic inflammation of the gum tissue and the bone that anchors your teeth, and diabetes exist in a bidirectional relationship that most people have never been told about. Elevated blood sugar impairs immune response in gum tissue, but here's what makes this the most dangerous ignored signal. Severe gum disease also independently raises blood sugar. The inflammation pathway runs both directions. Gum disease causes the release of inflammatory cytokines. Think of them as a volume knob that gets turned up on systemic inflammation, and those cytokines directly interfere with insulin signaling. A landmark study in diabetes care demonstrated that treating severe periodontal disease reduced HbA1c by an average of 0.4 points, equivalent to the effect of adding a second diabetes medication. People who have persistent gum bleeding, receding gum lines, loose teeth, or chronic bad breath that does not resolve with brushing are carrying an inflammatory burden that is actively worsening metabolic control. The statistic: diabetic patients are 2 to 3 times more likely to develop severe periodontal disease, and severe gum disease is present in the majority of people with poorly controlled diabetes. If your gums bleed when you brush, that blood is not normal. It is a signal that the inflammatory environment in your body is dysregulated. Grade this today, call your dentist, and specifically mention you want a periodontal screening. Tell them your metabolic health concerns. These two systems are talking to each other constantly. The medical and dental worlds just haven't been talking to each other. Here is your system. Do this once a week. It takes under 5 minutes and requires nothing but your own hands and eyes. First, look at the back of your neck in a mirror with good lighting. Check for any new darkening or velvety texture that was not there before. Second, count any skin tags in your armpits and neck. If the number has increased since last month, note it. Third, remove your socks and look at both shins side by side. Check for hair thinning, skin shine, and dryness. Fourth, test capillary refill on both lower legs. Press the skin and count the seconds until color returns. Fifth, drag a tissue along the bottom of both feet and compare sensation to your forearm. Sixth, brush your teeth and look at your gums in the mirror afterward. Note any bleeding or recession. Seventh, after your next high carbohydrate meal, notice your vision at 30 minutes and 60 minutes afterward. Write down any blurring. Eighth, if you have not had a fasting glucose and a fasting insulin test in the past 12 months, book one this week, not next month. The body gave you a free diagnostic instrument that requires no batteries, no subscription, and no appointment. It has been running continuously since you were born. It archives everything. It has been trying to show you what your bloodstream is doing long before any test confirms it. The only thing it cannot do is demand your attention. That part is yours. Send this to someone you care about who might be ignoring one of these signals right now. Someone whose neck you have noticed looks different. Someone who has mentioned their vision blurring. Someone who keeps talking about their feet being numb and passing it off as nothing. That conversation you have with them after sharing this video might be the intervention they never got from their doctor. Subscribe if you are not already. We are building toward 100,000 people who know how to read these signals before the crisis arrives. I will keep making these as long as you keep sharing them. And one last thing. Write in the comments your age, your country, and whether you found any of these signals on yourself today. That information helps me choose what to cover next, and it will show you that you are not alone in what you found.